Gum disease is an infection of the bone and of the gums, and that leads to inflammation. So those inflammatory markers, they travel in your blood throughout your circulation, and that carries over into the various different organs of your body. So all that inflammation, all the plaques that build up, can cause a disruption in the heart, which can lead to heart attacks, can cause build up going to the brain, and that can lead to strokes. And there has also been research on gum disease and Alzheimer's, early onset Alzheimer's disease. So there's also been links with mothers who have gum disease and low preterm birth weight babies.
Wow.
So it's very, very important that moms get their teeth cleaned throughout their pregnancy. It will help, they'll help the baby.
Right.
So your mouth is your gateway to your health, and there has been a lot of links to your entire body.
Yeah, I think that's a good way to put it, that the mouth is like the first almost line of defense for everything else, and
it just travels everywhere. It
Right.
just travels everywhere. So your oral health matters.
right, more than I think a lot of us probably thought
Yes.
previously. Like going to the dentist is very important because that can help prevent a lot of these types of diseases.
Sure. And then one of the things is gum disease is a silent disease, sort of like diabetes and high blood pressure.
Right.
You may not know you have those in the early stages until it becomes more of a serious problem. The same thing with gum disease. You may have gum disease, but you may not know it until you come and visit the dentist, and then we take x-rays and we do measurements, and then we determine whether or not you have experienced some bone loss. And so that is very, very important. Those annual checkups, super important. Those x-rays are super important. And then we can treat your mouth according to what you have.
So what would be some of the signs maybe that I should look out for in between dental visits, like that would show that I have gum disease, or maybe signs of gum disease?
Well, one of the major signs is bleeding gums. Your gums should not bleed when you floss or when you brush.
Ever.
That's not normal. No.
Wow.
That's not normal. So that's your first sign that you should come in and get your teeth cleaned. You also have a buildup of plaque and tartar. Those are like calcifications that start to build up in the mouth. And many times I have patients who say that their teeth are breaking apart, but it's actually not their teeth. It's the calcium buildup that is breaking down bit by bit, and they need to have their teeth cleaned. Another sign would be a bad breath. You know, there's a lot of bacteria that gets trapped in our tongue, and proper maintenance with the tongue scraper definitely helps, and your adequate cleaning to get in underneath the gums and all the nooks and crannies that start building up every day.